one of my patients from St. Lucia.
Ah.
Yeah, Maria and Anthony. I know they're looking at the program this morning.
Okay.
Welcome, Anthony.
Oh,
You
that's
know,
good,
yes,
that's good.
yes. So
Well,
you know,
today we're going to be talking about a
the
very
heart.
interesting area, the heart.
Yeah, you know, I have a nephew who's a cardiologist. He's a surgeon. So a cardiologist means a person who's trained in the heart. You know, and he was here late last year, I think in November, and he came to see me and we was talking about the heart, you know, because he liked what I was doing on Facebook. So I went to the clinic with him, you know, and the amount of people I saw there, man, waiting on him because they have heart troubles. It's amazing. In Grenada. So I asked him, I said, because he's based in Oklahoma. So I said to him, I say, what about where you at? He said, man, if you see people over there with heart disease and bypass and angioplasty, you know what I mean, and stint, meaning that they have blockages in the arterial walls, so they have to open the arteries and put a stint in this and block the flow. Lots of people, man. And heart disease is the #1 killer in America. Over 750,000 people die every year from heart disease. And cancer is the second leading cause of death in America. So heart disease is more than cancer. That means that people are eating the wrong foods. They're eating bad. And they clog up the arteries. And then they make us believe that you have good fats and you have bad fats. Yeah? And they say, eat all the good fats, but leave the bad fats alone. But even lots of the good fats are not good for you either. You see what I'm saying? Especially when you're getting older, man.
Yeah.
You're past the age of 30, you're gone. Yeah, you start to go down the hill. So when you pass the age of 30, your fat intake should be limited to only maybe a handful of fats per day. And I'm talking about the so-called good fats. And let me talk about cholesterol. And cholesterol could clog up the arteries. And they don't explain to people about cholesterol. So let's talk about cholesterol before we go to the heart, right? Now you have cholesterol, you have triglyceride, you have HDL, you have LDL, and you have VLDL. VLDL is what they call very low density lipoprotein, and the LDL is what they call the so-called bad cholesterol. Yeah?
Right.
But they're making people feel that the LDL is cholesterol. It's not a cholesterol, it's a protein. That's what they call it, low density lipoprotein. It's a protein that carries cholesterol. But it carries the cholesterol to the arteries. And they have the HDL, which is the so-called bad cholesterol. Good cholesterol. See? That carries the fats away to the liver to be excreted. So a lot of the time you go take what we call a lipid profile test, the doctor, and you look at your cholesterol and you say, oh, you have high cholesterol, 250, that's high. And it says, okay, but you have a good high level of your so-called good cholesterol, which is the HDL, so you don't have to worry. So men goes from a certain number and women go from a certain number. Now, they don't tell the patients before they put them on the cholesterol drugs like Lipitor and Crestor, all these drugs that affect your liver in a negative way. They don't tell them that cholesterol only harm you when it does what, Mikey? When it oxidizes. They don't tell you that. So, for instance, if you go to a doctor, a regular doctor, and you have a high cholesterol level of, say, 250, he will put you on a drug. See what I'm saying? But he don't explain to the patient that the cholesterol, if it's high and it don't oxidize, it don't harm you. So for instance, if the rain is falling on your vehicle every day, you don't wipe it, and what happens? It get rusty, right? That's oxidation. If you cut an apple in half, the apple turns brown, that's oxidation. See? That happens in the body too. If there is bad food coming in and you have a high level of cholesterol. So once your cholesterol is high, over 205, they want to put you on drugs, not letting you know that the cholesterol don't harm you unless it oxidizes. So if you, Mikey, have a cholesterol level of 250, 280, 300, and you're eating fries, grease, pork, barbecue, it's going to oxidize, it's going to harm you, yeah? But if you have a high cholesterol level of 250, 280, and you're eating avocados, flax oil, even primrose oil, it don't oxidize. And that is what we have to let people know today, that don't let them put you on a drug because you have a high cholesterol level. If your cholesterol level is high and it don't oxidize, it don't harm you. So that is the first thing I would like your audience to know today. Don't let them chuck that cholesterol drug on you unless your cholesterol is oxidizing. because of your diet.
Okay, so you would find that out only through investigating the person's diet?
Yes, well, yes, you have to look at what the person eats.
Okay.
Eat fried foods? Yes, well, you're going to oxidize. Your cholesterol will oxidize eating fried foods. So that's what I asked them. Eating greasy foods? Yes. Barbecue? Yes. Cheese? Yes. Fried eggs? Yes. Bacon? Yes. Well, your cholesterol will oxidize. See what I'm saying? Because you're putting more bad fats into the system. So then your LDL, the so-called bad cholesterol will rise. And then automatically your cholesterol will oxidize and harm you. And then guess where you start to get troubles? You start getting troubles in your heart. And that is the reason why I was talking to my nephew about the people's diet. Because in Oklahoma, as he was saying, lots of people eat lots of fattening foods, grease. And that's why a lot of Indian people have diabetes. You know what I mean? Because of how they eat. So let's talk about the heart today. Okay. And how we can avoid troubles in the heart. Right?
Right.
Because the heart is what? What it does?
It pumps your blood.
Pumps your blood. That's all it does. It just pumps your blood. All it does.
Mm-hmm.
It pumps. How many gallons of blood do you think your heart pumps per day?
Gallons.
1,960 gallons per day.
That's, whoa, that's a lot. It's working.
Every single day till you die.
Mm-hmm.
1,960 gallons of blood per day. And your blood is only how much? 5 quarts of blood. So then your heart is a workhorse. But in order for you to keep the heart healthy, you have to keep... Mike, I hope you just follow my program.
I mean...
In order for you to keep the heart healthy, you have to keep what? What healthy?
Go ahead. I know.
Mikey!
I don't want to throw off.
The earth.
I don't want to throw off.
In order for you to keep the heart healthy, you have to keep the earth healthy. Which is the earth? The earth is your digestive system.
Right.
That's where everything starts. And in order for you to keep the heart well, you have to keep the kidney well. Because the kidney controls the heart. Because we said on one of your programs that the kidney is water and the heart is fire. What out fire? Not water. So the kidney controls the heart. See? And the heart controls the kidney. So if a person is suffering from high blood pressure and the pressure keep on being high, 99% of the time they damage the kidney. They get kidney failure. Because the heart controls the kidney. And the kidney depends on the heart for what? For blood. So if the heart is not pumping 1,960 gallons of blood per day, if it slows up the blood movement of pumping the blood, the kidney will never ever be able to get enough blood to do what? To regulate your water balance. So once there is not enough blood going to the kidney will suffer, and then the kidney can never get rid of the excessive amount of water, and you start to get swelling of your feet. They call it edema in the medical system. So you see what I'm saying? You see the connection between both of them. If the kidney don't work well, the heart will never work well. If the heart don't work well, the kidney can never work well. And that's why when you have high blood pressure for a long period of time, it damages your kidney. And you have to go on dialysis long term. Just like diabetes. So we have to take care of the heart. See? So the heart pump 1,960 gallons of blood per day. Every single day. It can't. It's not supposed to, I would say can't. It's not supposed to pump more, and it's not supposed to pump less. If it pump more, the blood rushes to the brain fast, you get a stroke. You follow me, brother?
Right.
Because it's supposed to pump how much? 1,900 and what? 60 gallons of blood.
Let's say approximately 2,000.
Let's say approximately 2,000.
Okay.
And your pulse supposed to be between 60 and 70 beats per minute. That will tell you, and the respiration I think is 96. That will tell you for a fact that your heart is working okay. Once that pulse beat start rising up to more than 95, it's telling me that your heart or your thyroid gland is being affected, and it is affecting your heart. Because once you have an overactive thyroid gland, it's going to affect your heart in a negative way and make the pulse rise to more than 60 beats per minute. You have to have. That's when you go to a doctor, you take your pulse. He does that. See, put your hand right here and you check the pulse beat. You look at his watch. You look at the minute hand, and the minute hand will go 60. See what I'm saying? Once it starts to go boop boop, but in our medicine we don't look for this one pulse. We look for 7 different pulse beats. So we look for deep pulse, hard pulse, soft pulse of the heart. And I can tell you if your heart is strong, and I can tell you if your heart is weak by just doing the pulse. So when a doctor take a pulse beat of a patient, he's looking for one beat. I'm looking for different beats. I'm looking for hard beat, pulse, soft beat, stiff beat. And I could tell you what's going on with your heart from just doing that. See what I'm saying? Mm-hmm. See? So that will tell you for a fact what is going on with your heart. And electrocardiogram is also important too. So I don't fight that down. But you have to learn to take care of the heart. Now the heart have chambers, right? Then the heart have a left atrium, right atrium, left ventricle, right ventricle. Right? Look what happens. Right atrium, left atrium. One send blood to the right ventricle. The ventricle picks up what? All the carbon dioxide from over the whole body, from the foot to the toes, come back up, picks it up, and the atrium picks it up, send it to the one of the ventricles, and the ventricle sends it straight to your lungs. See what I'm saying here? See how they work together, right? Then the lungs send all out, send out that carbon dioxide, or carbon monoxide, what do they call it? And it picks up what? Oxygen. Only 21% of oxygen that we are allowed to inhale every day, no more than that. So the lungs throw out all the carbon, and it picks up what? Oxygen, and it sends it to the left or the right ventricle, and the left or the right ventricle sends it back to the left or the right atrium, back to the circle again. That's how it works every day. That's how it works every single day for you, back in and back out. See what I'm saying to you? Now the world we are living in today is polluted. So the air is all messed up. So we're inhaling a lot of smog. So that is bad for the lungs, bad for the heart. So that's how the heart works. There's different people that go to the heart, we're going to take a whole hour on the heart. But for the lay person, that's how the heart works every day. Right? So your heart beats 60 beats per minute. 60 beats per minute. Anything more than that, something is wrong with your heart. Anything less, something is wrong with the heart.
Doesn't it vary? Depends on age or whether or not you are very active or resting also.
Well, if like for instance, athletes have what we call murmurs, or they have sometimes they get an irregular heartbeat. They call it arrhythmia in the medical system.
Right.
Right. So some people will eventually inherit that. See, but in reality, if you go by the medical system now, your heart's supposed to beat 60 to 70 beats per minute.
Then that is also for women and men across the board?
Across the board. Doesn't differ for nobody. That's how the medical system has it. 60 to 70 beats per minute. If it goes over 80, 90, 95, something is wrong with the thyroid gland. And that's the reason why with people who have hypertension, we ask them to check the pressure when they're laying down and check it when they're sitting up. And that will give us an idea of what's going on with the thyroid gland. See what I'm saying to you? Right? Now, if the heart is being affected in a negative way, a few things happens. You get angina. That's one cause. That's one sign that something is wrong with your heart. Angina means you're getting pain where? Right there. Yeah, right in the middle of your chest, you're getting pain. That's angina. That's telling you that something is going on with your heart. Next one is called congestive heart failure. Congestive heart failure means that something is causing the heart to be congested. Either you're not treating your heart well, eating the wrong foods, and the arteries, or what they call the coronary artery, that's supposed to do what? Supposed to send rich blood with nutrients to your heart. Now you heard the word. I said rich blood with nutrients. With nutrients. You hear the word? Not dead atoms. Nutrients from the food you eat to the heart muscle. Because the heart muscle need what? Magnesium. The heart muscle need what? It needs CoQ10. In order for that beat, that systolic number to function well. So the coronary artery will send the rich nutrient blood to the heart. If the artery now, watch me now. See that here? If this is clogged, coronary artery that is, and it have a lot of plaque in the walls, that coronary artery can never ever send rich blood with nutrients to your heart, So your heart become congested, and your heart have to work extra hard to pump the blood through the vessel walls. And guess what happens to you? You get congestive heart failure, or you get an enlarged heart, or you get hypertension, and then you get a blockage. And when the blockage is there, your doctor will tell you you have to go and do a bypass, or you have to do what we call angioplasty, meaning that they put a stent in the artery system just to keep it open. They don't fix it though. But nobody going to tell you how you could fix it. Clean it up. A lot of people have trouble in the heart, and you know they have it. Short breath is a sign of it. Some people can't walk up a hill. I mean, something wrong with the heart and the lungs. You know what I mean? So, when you have or come down with high blood pressure, right? The first thing the doctors give you is they either give you an ACE inhibitor, they give you a calcium channel blocker, or they give you a water pill, or they give you a beta blocker. The beta blockers will give you that if you have angina, or they will give you a nitrate, a spray now, or a pill to put under your tongue if there is a blockage in the arteries and you get an angina, pain in your chest. That won't fix it either. So you have to live with that till you die from a heart attack. You see what I'm saying to you? Now, the ACE inhibitors that they give you, all the pills. So if you're listening, you're taking a linezolpril, Zestril, canalopryl, they're all ACE inhibitors. The ACE inhibitors, they increase potassium in your blood. So what's what they do now? That's a side effect. Because too much potassium is bad for the heart also.
And the kidneys as well?
Yeah, kidney too. So what they do, they say, oh, the ACE inhibitors is making the patient increase potassium. So what? We have to give you a diuretic, a Bearzide or a Lasix to remove the excessive amount of potassium from the body. The only problem with that is now you start to lack in potassium, so they have to give you another drug called Slow K.
Yeah. And then it starts going from one drug to the next.
There you go.
To the next, to the next.
That's the ACE inhibitors.
Right.
The beta blockers. I tell it all. What they do, they slow up the heartbeat. See what I'm saying? Once they slow up the heartbeat, as a man, you have impotence. Your penis can't get hard no more. Dead. Like Lazarus. You have to come and meet the rising back for you. You understand what I'm saying? That's number one, because the heartbeat slows up and everything is blood flow. And then the beta blockers, although they slow up the heartbeat, when they slow up the heartbeat and stop the blood movement, they start to give you what? High cholesterol. So they have to give you a cholesterol drug. The calcium channel blockers, Alpha-Pin, Novax. Guess what they do? They block calcium. Now, why would you want to block calcium? When you block the calcium from not going where it's supposed to go, what happens to you? The calcium goes where your soft tissues and give you troubles in your heart, plaque in the walls long term. And then they said to you, when you're taking the Alpha-Pin, you cannot drink grapefruit juice because grapefruit juice is going to contraindicate the calcium channel blockers. Why? Because grapefruit juice have a compound called naringin that potentiates the drug. But they don't tell people that the calcium channel blockers block calcium, whereby magnesium, which is a natural calcium mover, moves the calcium and sends it where it's supposed to go for bone to get it into the bones. So magnesium is your best choice. It don't block calcium, it moves it. See what I'm saying? Because I got a traffic cop. See? So people have to be educated about these things. Otherwise they'll take a joke forever and ever. Amen. You see what I'm saying to you? So when you come to me, you have high blood pressure. Your pressure could come from where? It could come from your heart, it could come from the lungs. They call it pulmonary. P-U-L, Let's say I pronounce it wrong. Hypertension from the lungs. The lungs, because the lungs will give you hypertension too. You could have pressure from the kidney, if the kidney is not manufacturing renin properly, or the kidney not moving the blood properly out of the system and retaining water, the water goes to your heart, you get cardiac edema. You can get pressure from the gallbladder. Your pressure could come from your digestive system. Your pressure could come from stress. Stress is a component of people who have hypertension if they are prone or they have what we call a genetic predisposition of getting it. Because once their adrenal glands is weak and not functioning well, they are hats on top of your kidneys now, they can also cause you to have hypertension. But the average medical doctor do not sit and ask a patient questions. Maybe few of them. So he can never know what is causing the patient to have hypertension. So if you don't find the cause of your problem, you can never fix it. You must find the cause. So what we try to do, we look at the gallbladder. The gallbladder have a meridian or a channel running from the gallbladder to the heart. EDTA in your arm with other minerals and bind with heavy metal and move the plaque out of the walls. But they don't do that because bypasses $80,000 and $90,000 US. See what I'm saying? So to unblock your arteries naturally, 15 peg of garlic, 10 lime with the skin on.
You cut the lime in half?
Cut the lime in 4 pieces.
Oh, 4 pieces. Okay.
And you crush up the 15 peg of garlic.
Okay.
With 1 or 2 pieces of ginger. Because ginger deals with circulation. Have ginger oil.
Right.
And you put it in a blender with the blender full of distilled water, or what we call purified water. You blend it up for 10 seconds. Yeah? And then you take it and put it into a stainless steel pot. Do not put those things in aluminum pots now. You throw it in a stainless steel pot and you simmer it on a low fire for 5 minutes. And you take 1 small rum glass every morning for 3 weeks. And you skip 1 week. And you go back again after the 1 week and do it for 3 weeks again. And you use, let me name the herbs now. Ginkgo, horse chestnut, prickly ash. Ginkgo, horse chestnut, prickly ash, collinsonia. And the reason why collinsonia, because lots of the time if you have plaque in the walls, it starts to weaken the veins. See? So the collinsonia in the mixture strengthen the vein. We did what we call vascular integrity. So when the vein becomes strong and the plaque starts to move, the veins are strong enough so the plaque can move out. So collinsonia, ginkgo, prickly ash, horse chestnut, lycium fruit, cinnamon. Don't forget the herbs now. You use them together with the garlic and the lime, and in 6 weeks, your arteries is unblocked naturally. We call it oral chelation. And we give you a product called CV Heart Formula. And the CV Heart Formula have EDTA in there, orally. So while you're taking the garlic and the lime, with the herbs I mentioned, you're getting a CV support. And the CV support have EDTA with other minerals, or tricardia, and they bind, and they get rid of the plaque in the walls naturally. And your arteries is unblocked. You don't have to go and do angioplasty. You don't have to put those stents in your arteries. That don't fix nothing. Bypass don't fix you, because once you do bypass, you don't have a quality of life. It's bad, you're gone. If you have high blood pressure, and your pressure is mild to moderate, let's look at 140 systolic, 90 diastolic. That's moderate hypertension. You're not supposed to go on a drug for that. Period. If you have a pressure reading of 150 diastolic to 100 systolic and 100 diastolic, you're not supposed to go on a drug for that. If you have a reading of 200 systolic, top number that is, when the heart is beating, and you have another beating of systolic of 105, you have severe hypertension. And that's when you should be taking a doctor's medication for that, until you can find out what is causing you to have that problem in your heart. Because some people who paint cars, the chemical from the paint affects the liver and the gallbladder, and they get hypertension from that too. Mercury in your mouth, the fillers in your mouth, mercury could give you hypertension too. That's why they don't use mercury no more, and get into your brain. Magnesium, if there is mercury in your mouth, it depletes magnesium from the heart muscle. It depletes magnesium from the hippocampus of the brain. So you get Alzheimer's disease faster, and even Parkinson's disease, because all the dopamine decreases. You see what I'm saying? So we give you magnesium, 800 milligrams per day of the magnesium. When you have troubles in your heart, you must use folic acid. F-O-L-A-T-E, not folic. F-O-L-A-T-E, not F-O-L-I-C. F-O-L-A-T. You must use 2,000 to 3,000 micrograms of folic acid per day. Once you have troubles in your heart, you must implement selenium in your diet. Why? Because once you have troubles in your heart and there's free radicals, molecules that's negative, running around in your heart muscle, damaging your heart muscle, you must use what we call free radical scavengers. You must use selenium. Once you have troubles in your heart and have hypertension, you must implement 460 milligrams of CoQ10 per day. Once you have troubles in your heart, you must use L-tyrene to jumpstart the heart muscle. 500 milligrams per day, half an hour before your meals. When you have troubles in your heart, you must implement L-carnitine in your diet. 500 milligrams per day, first thing in the morning before you have your meals. And once you have troubles in your heart, you must use a herb called Horton berries. Horton leaf, Horton flower is the best herb for your heart. Why? Because it acts as an amphoteric. If the heart is beating too fast, it slows it up. Heart is beating too slow, it speeds it up. Pressure high, brings it down. Pressure low, brings it up. A wonderful plant. Plus, it drops your cholesterol naturally and prevent plaque. I'm going to use the word loosely. It prevents plaque from forming on the walls of your arteries. They don't tell people that though. Once you have hypertension, you must use mistletoe. Once you have hypertension, you must use mother's wort. It calms the heart. Once you have hypertension and it's coming from your adrenal glands, you must use oat straw and you must use another herb called Siberian ginseng or schizandra berry, because they work in the endocrine system. Once you have hypertension and it's coming from your gallbladder, you must implement wild yam. Once you have hypertension and it's coming from your stomach, you must use yarrow. Follow me. Once you have hypertension and the heart muscle is weak, you must use night blooming cereals and all these herbs together. And when you mix them together, you take 1 teaspoon to a cup of hot water. You cover it for 5 minutes. You strain that and you drink 3 cups per day. And I don't see how you can fix your heart. And if there is trouble in the heart, you have a weak heart, they give you what? Guess what they give you? When you have a weak heart, they give you digoxin. Linoxin, same drug. But here what I want to tell you. They fight on all the herbs now. But ask them doctors who give you that drug, ask them where does linoxin or digoxin come from. They give it for a weak heart. It comes from a herb called foxglove. We don't use foxglove because it's a poisonous plant. But they take out all the alkaloids from that plant and they put it into a drug called digoxin for weak heart. So we give you what? We don't give you foxglove, we give you lily of the valley when the heart is weak. It's called a digitalis. And we strengthen the heart muscle. But if the heart is weak, we must tonify the heart muscle first. And with herbs like Horton berries, and once the heart is strong, then we come in and give you now the lily of the valley to strengthen the heart muscle so the heart could push the blood to the vessel walls and you will see your heart troubles disappear and your high blood pressure gone.
Just like that.
Just no fried foods, no greasy foods, no barbecue, no ham, no spam, no lamb.
All right.
That's why people get in these troubles, Mikey. Because people they're not educated about diet and how to eat. So you have troubles in your heart, and you come and you say to me, Mr. Dells, I have troubles in my heart. I have hypertension. I say, you drink coffee? Yes. Bad. No, that's bad for your heart already. You drink soft drinks? Yes. Bad for your heart already. You say eat fried food? Yes. How often? I eat it. So that's bad for your heart. So how you going to have hypertension, heart troubles, and eat fried foods? When you're supposed to know or be educated knowing that the fried foods is the one that causes you to have trouble in your heart in the first place. So you can't eat it. So I said, you drink water? How many glasses a day? 3 glasses per day. So yeah. So how come you don't drink 8 glasses of water per day? The body functions on water. Last question. How is your bowel habits? How many days you go to the bathroom in a week? 3 days a week. I said, well, you must have trouble in your heart. You see what I'm saying here? Because if you don't go to the bathroom every day to remove waste out of the bowels, out of the earth, common sense will tell anybody that sewage system, we call the bowels or the large intestines, will send toxins back into the blood. And if your heart have to pump the blood to the vessel walls, and it have to get rich nutrient blood from the coronary artery, and if that blood is contaminated from bad bowel health, you're not going to the bathroom, you must have troubles in your heart. This is a common sense thing, Mikey. Because your blood must be clean. Because the blood is your life. So you must keep the bloodstream clean in order for the heart to work well. You must have your body functioning in an alkaline system because your heart works better when the body is alkaline than when it's acidic. The heart work better when your colon is clean. Your heart work better when you don't have trouble in your digestive system. Your heart work better when you don't have gallstones. Your heart will work better when you don't have trouble in the kidney and in your lungs. So you have to have them in balance. And once you have them in balance, you eat right, and you don't go lay down with food in your belly at night, your heart will repair because the body heal itself. Blessed love.
All right.
I don't talk.
All right.
Enough said.
That's Mr. Worldwide himself,
Sir.
Herbalist Patrick Dells, as we spoke about the heart and how to keep the heart healthy. Again, quite enough said. Thank you again.
I mean, the heart will take a whole hour and a half.
Yeah,
Stop with the heart.
I know, right?
There's so much information about the heart. There is so much thing I learned about the heart, man. You'll be amazed. Right. I'm not a cardiologist, but I can tell you how to take care of your heart, though.
Right.
I ain't give you no drugs. Herbs is the best choice. Plant-based diet is the best diet for people with heart troubles. And that's why President Bill Clinton, after he did his bypass, he's a vegetarian now. He's a vegan. Because his doctor said to him, listen, man, you have to stay on a vegetarian diet, because if you go back eating that same old fresh food, your heart will kill you eventually. So he had to go back to the plant-based diet. That's the key in having a good heart, or keeping the heart healthy. Yeah?
All right.
Blessed love, and give thanks and praise to the Most High. You want a number?
Yeah, sure. Yeah.
473-416-2310, that's my number. Or for the retreat, you can call 473-534-0209. That retreat is getting bigger and bigger every day, and we'll give you some more information about the retreat, our retreat in Grenada. And my email is naturalhealingofthebody75 at gmail.com. My Facebook page is Patrick. Yeah.
All right.
Yeah.
And give us the number again.
The number is 414-734-16-2310. And if you want to come to the retreat in Grenada, the number is 473-534-0209. I hope I didn't speak too fast.
All right.
Blessed love.
All right. Thank you very much.
Yes,
again,
man.
Patrick.
Thanks. Yes, sir.
Nice. All right, thanks, folks, and you can join me for the rest of the program. WeFMGrenada.com. Take care, and thanks for watching.